From rat poison to life-saving medication? Check out these drugs that were originally developed for one purpose, but ended up finding new life as treatments for completely different conditions. From hair growth to preventing migraines and treating autoimmune diseases, these repurposed drugs have changed countless lives. Find out more in this eye-opening list. Thalidomide. This drug was first developed as a sedative and anti-nausea medication in the 1950s, but was later found to cause severe birth defects. Despite this setback, thalidomide was eventually repurposed as a treatment for multiple myeloma, a type of cancer that affects white blood cells. Botox is a type of botulinum toxin that was initially developed as a treatment for muscle spasms and eye disorders. However, it is now most commonly used as a cosmetic treatment to reduce the appearance of wrinkles. Aspirin was first developed as a pain reliever and anti-inflammatory medication in the late 19th century. Since then, it has been repurposed for a wide range of uses, including preventing heart attacks and strokes, reducing the risk of certain types of cancer, and even treating depression. Rogaine, also known as minoxidil, was initially developed as a treatment for high blood pressure in the 1960s. However, researchers discovered that it also had the unexpected side effect of promoting hair growth, which led to its use as a treatment for male pattern baldness. AZT, also known as azithromycin, was initially developed as a potential chemotherapy drug for the treatment of cancer. However, its development was halted due to its toxicity and lack of effectiveness. In the 1980s, researchers discovered that AZT had potential as a treatment for HIV/AIDS, as it targets the reverse transcriptase enzyme that is essential for the replication of the virus. Rituximab is a type of monoclonal antibody that was first developed as a treatment for certain types of lymphoma. However, it has since been repurposed for a wide range of autoimmune diseases, including rheumatoid arthritis, multiple sclerosis, and lupus. Propranolol is a beta blocker that was first developed as a treatment for high blood pressure in the 1960s. However, it has since been repurposed for a wide range of uses, including treating anxiety, preventing migraines, and even reducing the risk of PTSD after a traumatic event. Risperidone is an antipsychotic medication that was initially developed for the treatment of schizophrenia. However, it has since been repurposed for the treatment of a wide range of other conditions, including bipolar disorder, autism, and even some types of dementia. Tamoxifen was first developed as a treatment for breast cancer in the 1970s. However, it has since been repurposed for the prevention of breast cancer in high-risk women, as well as for the treatment of certain types of infertility. Thalidomide was developed in the 1950s as a sedative and anti-nausea medication. It was later found to cause severe birth defects when taken by pregnant women. However, in the 1990s, thalidomide was discovered to be effective in treating leprosy and multiple myeloma, a type of blood cancer. Botox is derived from a toxin produced by the bacteria Clostridium botulinum. It was first used in the 1980s to treat muscle spasms, but it was later discovered to have a cosmetic use as well. Botox injections can temporarily smooth wrinkles and fine lines by paralyzing the underlying muscles. Topiramate was approved by the FDA in 1996 as an anticonvulsant medication. It is used to treat epilepsy and prevent migraines. Studies have also found that topiramate may be effective in reducing alcohol cravings and helping people quit drinking. Metformin was first approved by the FDA in 1995 as a medication to treat type 2 diabetes. It works by reducing glucose production in the liver and increasing insulin sensitivity. Recent research has suggested that metformin may also have anti-cancer properties, and it is being studied for its potential in cancer prevention and treatment. Rituximab is a monoclonal antibody that was originally developed to treat certain types of lymphoma. It works by targeting and destroying cancer cells. However, it has also been found to be effective in treating autoimmune diseases such as rheumatoid arthritis and lupus. Warfarin is a blood thinner that was first used in the 1950s as a rat poison. It works by blocking the action of vitamin K, which is needed for blood clotting. Warfarin is now widely used to prevent blood clots in people with conditions such as deep vein thrombosis and atrial fibrillation. Minoxidil was first developed in the 1960s as a blood pressure medication. It works by dilating blood vessels and reducing blood pressure. However, it was later discovered to have a side effect of promoting hair growth. Today, minoxidil is commonly used to treat hair loss and promote regrowth. Sildenafil was originally developed in the 1990s as a medication to treat hypertension and angina, chest pain. However, it was found to have an unexpected side effect of improving erectile function in men. Sildenafil is now commonly known as Viagra and is one of the most widely prescribed medications for erectile dysfunction. Propranolol is a beta-blocker medication that was first approved by the FDA in 1967 to treat high blood pressure. It works by slowing the heart rate and reducing the force of contractions. Propranolol is now also used to treat migraines, tremors, and anxiety. Tamoxifen is a selective estrogen receptor modulator, SERM, that was first approved by the FDA in 1977 to treat breast cancer. It works by blocking the action of estrogen in breast tissue, which can help prevent the growth of tumors. Tamoxifen is now also used for breast cancer prevention in high-risk women, as well as to treat other types of cancer such as ovarian and endometrial cancer.